Hi, I'm Dr. Ellis, board-certified ophthalmologist and medical director for LasikPlus Vision Center in Kansas City. Thank you for visiting us today. I chose to partner with LasikPlus for many reasons, including the opportunity to join a world-class network of expert LASIK surgeons. At LasikPlus, we place a strong emphasis on providing the very best quality of patient care at an exceptional value.
The extensive testing you are receiving will provide us the medical information we need to assess whether you are a safe candidate for laser vision correction. But the medical testing is not the only factor. Just as important is the discussion we will have with you regarding your expectations and reasons for considering laser vision correction. Since no two eyes or patients are the same, a customized treatment plan will be designed according to your specific needs. When the cornea has too steep a curve or the eye is too long in relation to its corneal curvature, images focus in front of the retina instead of on it. That's nearsightedness, and the result is that you can see objects up close, but the distance vision is blurry. Farsightedness occurs when the cornea is too flat or the eye is too short. This causes images to focus at a point beyond the retina. If you're farsighted, you have difficulty seeing objects both up close and at a distance. If the cornea is shaped like a football, more curved along one direction compared to the other, then images bend in such a way as to create no single point of focus. This is called regular astigmatism, and it results in blurry and often distorted vision. As we age, usually in our early 40s, the lens inside our eye begins to lose its flexibility. This condition, which affects us all, is called presbyopia and results in the use of bifocals or reading glasses. First, your eyes will be completely numbed using only drops. A laser is then used to create a hinged corneal flap, which is painlessly lifted to expose the cornea for laser reshaping. Cool pulses of ultraviolet light from the laser are then computer-guided to precisely and smoothly sculpt the cornea's inner surface. You'll hear a steady clicking sound as the laser is operating. You're also likely to notice a mild smell as the corneal tissue is removed. Your surgeon has full control of the laser and can turn it off at any time. After the laser, which typically takes from 10 to 60 seconds per eye, the corneal flap is repositioned and it self-adheres. Because of this bonding quality, no stitches are needed. Once the cornea is reshaped, light is able to focus directly on the retina, thus providing clear vision. If treating nearsightedness, the laser removes tissue from the center of the cornea, making it flatter and reducing the focusing power. This moves the point of focus from in front of the retina back to the retina. If treating farsightedness, the cornea is made steeper as the laser removes tissue from the periphery of the cornea. This helps the cornea bend light more and moves the point of focus from somewhere behind the retina back to the retina. If treating regular astigmatism, the laser removes tissue from the flatter meridian, thereby making the cornea more spherical or round. This allows light images to come to one point of focus on the retina. We perform both LASIK and PRK procedures and will recommend the procedure customized to your individual needs. We offer all laser LASIK, meaning lasers are used to create the corneal flap as well as reshape the cornea. Both lasers use cool pulses of ultraviolet light. After LASIK, most patients return to their routine activities the following day.
For some patients, LASIK may not be the best option, so we also offer PRK. Unlike LASIK, with PRK, the anterior epithelial surface of the cornea is gently removed, and a laser precisely reshapes the curvature of the eye, just as in LASIK. After PRK, a contact lens bandage is placed on the surface of the eye to allow the epithelial cells to regenerate. For this reason, the healing time may be longer with PRK. During that time, tearing and blurriness may occur. PRK is typically recommended for patients who have shape variations or thinner corneas, making it safer not to create a corneal flap.
Eye drops will be used to completely numb your eyes, so most patients experience very little, if any, discomfort during the procedure. The procedure from start to finish takes only minutes. In fact, most patients are able to go back to work the very next day after their LASIK treatment. After your treatment, we recommend that you go home and take a nap. When you wake up, you may experience some irritation or dry eyes. Use of the prescription and wetting eye drops will help alleviate this discomfort. It's important that you not rub or touch your eyes for 2 days after your treatment. After taking a nap, most patients are able to resume everyday activities such as watching TV, reading, computer use, or spending time with friends and family. It's important to remember that laser vision correction is a medical procedure. Because there are different types of treatments, the healing process and level of discomfort varies from person to person. In order to promote healing, it is important that you not rub or touch your eyes for 2 days after your treatment. If you have any questions, we encourage you to ask your doctor. You should also be aware of some potential problems that could arise.
The goal of the laser vision correction procedure is to provide long-term vision that is equal to or better than the kind of vision you had with your glasses or contacts. The laser vision correction procedure is not a guarantee of perfect vision. For a small percentage of patients, an enhancement procedure to fine-tune the vision may be necessary. Your doctor can answer any questions you have about this.
We want to help you experience life free from the hassle of glasses and contacts. This is why we provide custom all-laser LASIK for 20% the national average price and guaranteed financing for every patient. We promise to work with you to find a plan that fits your budget, from zero-interest plans to plans with monthly payments of around $100.
In some instances, some of the surface cells of the corneal flap may become irritated or come off during the procedure. These abrasions heal very quickly. Some abrasions may require the use of a bandaged contact lens to promote quick healing. Rarely, the corneal flap is too small or incomplete to allow us to complete the treatment. After some healing time, we can reschedule the treatment.
Your eyes will probably feel a little dry for a while after the procedure. Some people may not have dry eyes at all, while others might have dry eyes for several months afterwards. After your treatment, it's important to apply the topical artificial tears prescribed by your doctor several times a day.
Many patients will experience some glare or halos, at least on a temporary basis, for 1 to 3 months after the procedure. This is due to the natural healing process and the swelling of the cornea that occurs following the LASIK procedure. Other factors, such as the degree of your prescription, aberrations of the cornea, dry eyes, and the size of your pupils, may affect glare and halos as well. To reduce the likelihood of glare or halos, we will use multiple laser technologies that will be custom matched to your eyes. Infections as a result of this procedure are extremely rare. Actually, there's a greater risk of infection with contact lenses than with LASIK. It's important for you to adhere to the follow-up care that we will discuss with you and to attend your postoperative exams. A small percentage of patients may develop ectasia, which is instability in the cornea that may develop years after the procedure. If you are one of these small percentage of patients, you may require glasses or contacts to correct your vision because your eyes cannot be retreated. LasikPlus has multiple laser technologies to customize your treatment. It's important to remember that the skill and experience of your eye surgeon is the most important factor determining the outcome of your procedure. Our team looks forward to meeting you and helping you see clearly without glasses or contacts.